The megaloblastic anemias, the word pretty much describes it. These are large red blood cells, and it's because of ineffective erythropoiesis. Think of folate deficiency or vitamin B12 deficiency. We don't see this much in this country. If you're thinking of megaloblastic anemias, think of these deficiencies, and again, the cells are large. You have macrocytosis. There will be a low reticulocyte count, and the red blood cells may be nucleated. That means that they're somewhat immature. On bone marrow, you will see a hypercellular bone marrow. Here we have a smear that shows a megaloblastic anemia. You can see that the red blood cells, right here, this is a red blood cell. It's somewhat large. How do you know that? Well, you compare it to this cell. This is a poly. And polys tend to be bigger than red blood cells, but in this case, they're almost the same size. So that's telling you that you have a megaloblastic problem. Folic acid deficiency. We get folic acid from green leafy vegetables. And folic acid deficiency usually peaks by 4 to 7 months of age. Always remember goat's milk. We've mentioned this in the nutrition chapter. Any baby or infant that is on goat's milk for whatever reason, sometimes they just get put on that, they are at higher risk for folic acid deficiency. That'll be your classic presentation, especially on the test. These patients will have normal to increased iron levels, but the treatment for these patients is going to be folic acid intake. Vitamin B12 deficiency. Vitamin B12 comes only from animal sources. Remember that vitamins are things that we ourselves don't produce. We need to get it from an outside source. You're going to see vitamin B12 deficiency from inadequate production or intake. So vegans are at higher risk for developing vitamin B12 deficiency. Also, gastric surgeries and bypasses. You may not absorb the vitamin adequately, and terminal disease, terminal ileum disease is also a contributing factor for B12 deficiency. These patients will present with weakness, fatigue, failure to thrive, and a very important one is glossitis. That's that smooth tongue. If they describe a smooth tongue, think of B12 deficiency. A lot of what we do here in reviewing for the exam is word association. So if you see the word glossitis and they're talking about a couple other symptoms and signs like lethargy and failure to thrive, and they're describing anemias, think of vitamin B12 deficiency. And the treatment will be parenteral replacement.